There is a 17% increase in the calls to the Seniors Abuse and Information Line.
Among the key findings in a new report on the well-being of BC seniors is that troubling stat. Elder abuse calls in the province have jumped up, and now the BC Seniors Advocate Isabel Mackenzie has started a separate, more thorough review into the problem.
But it's still, relatively speaking, it's a small number of calls. And what we're more concerned about is that when you think about there's 1 million seniors in British Columbia, or pretty close to 1 million seniors right now, and this represents 1,500 phone calls, we realize that there's much more going on than we are aware of.
The report says 5,558 calls went to the seniors line, and 28% of those calls were related to elder abuse. Her report also says it's unclear on how big the problem is because of a lack of tools to measure neglect or abuse of seniors and a lack of public understanding on what elder abuse is and how to report it.
And so I think all of these are pointing in the direction of the systemic review that we've undertaken and hopefully will release in the early part of 2021 to talk about what we could be doing better.
The new report also says the average wait time to get into long-term care has also increased by 3%, or 133 days.
We have found that all of the indicators are aligning to show an increase, that we have more people on the waiting list, but that's a snapshot in time. However, they've been on the waiting list longer than in previous years. People who were admitted to long-term care last year waited longer than the people who were admitted the year before. And the percentage of people admitted within 30 days, which is sort of our goal, dropped from the previous year.
The good news, 94% of BC seniors continue to live independently in their own homes, and the overall health of seniors remains relatively stable. During the pandemic, Louise Tremblay at the Seniors Come Share Society has seen an increase in demand for their services which seek to improve the lives of seniors at home.
The calls to our lines have tripled since the pandemic.
But the data in the new report only captures April 2019 to March 2020, and therefore doesn't go over the impacts of the COVID-19 pandemic on BC seniors. But Isabel Mackenzie can guess.
We know that long-term care has been challenged around admissions because of COVID. When a care home is in outbreak, it's closed to new admissions. So we may see increased pressure on our waiting lists, and we may see a decrease in our number of new admissions overall next year. So we'll have to wait and see on that.
The report covers everything from healthcare to transportation based on data from 2019 to 2020. Keir Drunos, City News, Vancouver.